Hi, my name is Heather Keeler-Johnson. I'm here today to share the opportunity of making a donation to South Dakota Urban Indian Health. I'm really excited about this. I'm really excited about this opportunity to share with you. I'm extremely passionate about the work that they do. I want to start with sharing a story about my dad. He was a great guy. He suffered with heart disease and he struggled with cancer during his life. He died at the age of 62. Simply because he didn't have the opportunity to have preventative care. That's what I feel. He didn't have the preventative care early on in his life to help him make healthier choices. And so this is why I'm so passionate about South Dakota Urban Indian Health and what they're doing. This is a facility that my dad could have really used the advantage of. He was a smoker. He was a little bit overweight. And there wasn't anything like this out there for him. And so when he passed away at the age of 62, he had a 1.5-year-old grandson. And since then, he's missed one of his grandkids being born. And he's not here for this grandson. And so I want to go over some of the things that I feel are important for you to make a decision on whether or not you want to become a donation, if you want to make a donation to South Dakota Urban Indian Health. I'm going to talk a little bit about some statistics to start off with the life expectancy and what some of the leading causes of death are in South Dakota. And then I'm going to move on to the risk factors of those and then talk about what South Dakota Urban Indian Health is doing to help prevent some of that. And then their funding resources and provide you with some opportunities and kind of lay out what some of the donation options would be to really help make a difference and really help make an impact on changing the health disparity for the Native American population in South Dakota. So I want to start with the life expectancy, and I've made a simple chart here for you to see. Now I've separated it into Native American and White American population in South Dakota. The reason I did this is because these are the two highest racial populations in the state, and actually when you look at research, there's not a whole lot for any other race in the state. So if you look at life expectancy for both male and female together, for the Native American population, it's the age 68. For the White American population, it's the age of 80. That's 12 years difference. That's kind of a lot for one state to have such a huge difference, because if you look at the national average, the Native American life expectancy is age 77 versus the White American, which is only 79. So that's much closer. And so you can see that there is a large disparity in South Dakota alone. Now, the highest risk factors, or the highest leading causes of death for this population, is 25% due to heart disease, and then 22% due to cancer, which if you add those together, it's really close to 50% of the reason why the Native American population is passing away so much earlier, which both things can be prevented, they can be screened. And I'm actually going to talk about the risk factors around heart disease because that is the leading cause of death for the Native American population. And so when you look at risk factors, there's things as simple as diabetes, which is really high in the Native American population just in general. You see a lot of people get diagnosed with that very early in their life. The other thing is smoking. Other bad habits that create you to just be overweight, not making healthy choices, having stress and depression, and then like high cholesterol and other things like that. Now, the treatments for these or the preventative care for these are things that as simple as making healthy lifestyle changes. So learning how to eat better, working out more often, understanding how to manage your stress, and it might even take medications for your cholesterol or depression. And so this is all of the things that South Dakota Urban Indian Health feels is important. Now, if you look at the general and the mainstream healthcare systems, I like to use the term that they're kind of just a revolving door. You go in when you're sick with something and they help you cure that day what you're sick with, unless it's pretty major health issues. Nobody really sits and does what's called holistic care, which is kind of where South Dakota Urban Indian Health aims their healthcare system at. So what they do is they look at, okay, here are all of the risk factors, and here are the things that we can do to prevent them, because it's easier to help more people if we put our money into preventative care than just kind of doing what's called life or limb, which is like at the end of when something's really bad, then you have to spend more money to help one person versus putting your money into helping a lot of people in these preventative services. So some of the things that South Dakota Urban Indian Health does is very unique. They have 2 clinics in the state of South Dakota. Now, some people live in those communities, so the drive isn't very long, and then some of them have to travel anywhere from 2 to 3 hours to reach these facilities. But if you think of South Dakota, it's a huge state, and people have to travel like a long ways to get anywhere. So they have a kitchen, and it's a huge kitchen. And they invite families to come in, and they teach you how to make healthy foods, and they like good healthy foods, not just, you know, boring healthy foods. Sometimes they don't taste very good. But they have a dietary nutritionist on site who helps you understand all the dynamics of cooking. And now, one thing that's known is the healthier options are always more expensive. And we're dealing with a population and a patient base here that 89% of the population that utilizes Urban Indian Health are under the 200% poverty level. So if you think about that, or they're on state assistance for food, so they get a little bit of money that they need to go a long way to feed a family. And so some of the things that aren't so healthy for us are the better financial option. And so the nutritionist really helps these families learn how they can use their money and also have healthy foods and make healthy foods. They have gyms at both of their sites. So as long as you're a patient there and you've gone through one course to learn how to use the equipment, you can come and work out at any time. And they have little contests that go on throughout the year, and it's not like these huge extreme contests. They're more like if you can come and walk, 3 miles a week, just to kind of get you in the habit of being more active. They also have a garden that's outside that's beautiful, and it's a raised garden, so people who have a hard time getting down to the ground can still be a part of gardening and planting these foods. And they plant a ton of vegetables, a ton of fruit, a lot of culturally native foods. And then at the end of harvest season, they invite everybody back and they have a huge feast, and they show people the advantage of gardening and planting your own food and how good that can be. And they get the youth involved and how fun it is. And so hopefully with the youth getting involved, they can kind of build some changes in their lifestyle moving forward. They also have a traditional healing room, and it's used for conferences. You can use it for meetings, but they have this available for people who need to come in and just maybe spend some time learning some stress management tools, meeting with a counselor or a mental health specialist. And they do it in a setting that's not just an office or not just kind of a boring white space. This place is a very calming place for people to come. And then they start out with young kids with activities and going and doing a lot of fun things in the summer to help them learn how to be active. So these are the things that they're doing in the bigger picture to try to eliminate those risk factors, so that, one, our population as a whole can be healthier for longer, but then they're not finding these issues so far down the road that they can kind of prevent them. And so that's what Urban Indian Health does, and that's what makes them so unique and what I think makes them so cool. So I want to talk a little bit about their funding sources. Now, like I mentioned earlier, they're mainly funded off of grant funds, and then also with the poverty level of the patients that they see, they depend a lot on their federal grants. And so there's 3 different funding sources for this clinic, and 74% of it is through federal grants or state grants. Now this is taking the director and her staff weeks and weeks and weeks of working 60 to 70 hours a week just to write these grants, to put them together. So it's a lot of work to get, and they are extremely lucky to have those grants. Now 18% is what's called third-party billing. Now third-party would be your Medicaid, your Medicare, insurance payments, but then also any patient payments that can come out. So what that leaves is 8% open to the donation pool. Now, with this being a smaller organization, they don't tend to receive a lot of donations. They might get a little donation here or there from a family that the clinic was really a big part of, if they pass away or something. But really, on an average level, there's not a lot of people who are providing donations to help all of these awesome activities take place. So here is your opportunity, and here's my donation request for South Dakota Indian Health, Urban Indian Health. I am looking for 100 donors, and that can be individuals, that can be families, that can be banks looking for people. I know there's organizations sometimes that if you're an individual and you go to your HR department, they might actually match your donation. But you could pick any of these options or any other that you choose you want to. But if I could find 100 people, 100 donors, to either make a $40 weekly donation every week throughout a year, $160 donation every month, or $2,000 donation in a year. If 100 people would do that, that would be more than the 8% that they needed. And I think that that would be really exciting, because not only would it cover the programs that they're doing, but it would also give them a little bit extra to maybe explore some of the new opportunities that they want to do as well. So I've taken the time to share with you the life expectancy and some of the causes of death in the Native American population, what the risk factors are, and what those preventative care opportunities are, but then also what South Dakota Urban Indian Health is doing and what they're providing to help eliminate some of those, and then the funding resources and the donation opportunity that you have to try and help close the gap financially to increase the health care for the Native American population. So I appreciate you taking the time to listen. I hope that you take into consideration making a donation, and like my dad, and like many other grandmas and grandpas out there, I feel like 62 or 68 years old is just way too young, and you miss out on a lot of things that are going on in life still. So thank you.